Welcome back to Parenting Your Parents, where we offer guidance, resources, and support for those stepping into the role of caregiver for their aging loved ones. Today, we're covering an incredibly important topic: how to navigate the unexpected hospitalization of a parent. This situation can be overwhelming, but with the right questions and a solid plan, you can make sure your parent gets the care they need. We'll also share how NestCare's private duty nurses can be your partner in managing care, both during and after a hospital stay. First and foremost, you need clarity on the reason for your parent's hospitalization. Here are some essential questions to ask as soon as you arrive. First, what is the specific reason for my parent's hospitalization? Second, who is the primary doctor or specialist in charge of their care? Knowing these answers will help you understand the situation and open up communication with the healthcare team. It's also important to ask, can you provide a brief overview of the treatment plan? And what are the treatment options? This will give you a sense of what to expect moving forward and allow you to advocate for your parents' needs. Remember to take notes and keep track of changes in your parents' care plan, medications, and treatments. Hospital stays can be confusing, with multiple doctors, nurses, and specialists involved in your parents' care. To make sure you're always in the loop, consider asking these questions. How frequently do the doctors round on the patients? And what is the best way for me to get updated information on their condition? It's also a good idea to know the hospital's visitor policies, which can vary depending on the situation. What are the current visitor policies? If your parent requires specialized equipment like oxygen or IV pumps, be sure to ask, does my parent require any special equipment during their stay or after discharge? This will help you plan for a smooth transition back home. At this point, you'll want to have a clear understanding of any upcoming procedures or tests. Are there specific procedures or tests scheduled, and what are they for? It's also critical to assess your parent's mobility. If your parent struggles with walking or getting out of bed, speak up. Ensuring that mobility is addressed during the hospital stay can reduce the risk of complications like bed sores or muscle weakness. Ask the team, how is my parent's mobility being addressed? Will there be therapy during their hospital stay or after they're discharged? One of the most overlooked resources in hospitals is the social worker. They can be your advocate, guiding you through complex decisions about care and discharge planning. Make sure to ask, is there a social worker or family liaison available to help with discharge planning and coordination? Discharge planning should start as soon as your parent is admitted. This includes understanding what needs to happen for your parent to safely leave the hospital. What needs to happen for my parent to be discharged? What kind of care will my parent need after leaving the hospital? Be sure to clarify who will walk you through the discharge process, who will discuss the discharge plan and post-hospital care instructions with us. This is where NestCare's private duty nurses can truly make a difference. Post-hospitalization can be a fragile time for your parent, and managing medications, follow-up appointments, and potential therapy can be overwhelming. NestCare's nurses help bridge this gap, ensuring a smooth transition from hospital to home. They'll work with you to make sure your parent's discharge plan is executed seamlessly. Does my parent need help managing medications or therapy sessions after discharge? How can private duty nurses assist with this? NestCare's team is also equipped to monitor for complications that might arise after leaving the hospital, such as infections or adverse reactions to medications. Our nurses provide peace of mind by keeping a close eye on recovery and ensuring that signs of potential issues are addressed promptly. Once your parent is home, it's crucial to monitor their condition closely. Be sure to ask the hospital staff, what additional signs and symptoms should we look out for at home? You'll also want to understand if this hospitalization has made your parent more vulnerable to future health problems. Does this hospitalization put my parent at risk for other issues or infections? And of course, long-term recovery may require changes in lifestyle or living arrangements. If your parent has increased care needs, NestCare's private duty nurses can provide ongoing support. We can assist with daily care tasks, therapy, and even provide around-the-clock care when needed. Once your parent is stable, the goal is to keep them healthy and out of the hospital. Ask the doctors, what are the next steps after hospital discharge? Are there any lifestyle modifications we should implement to avoid future hospitalizations? Our team at NestCare can help you create a care plan that focuses on preventing future health issues, whether it's managing medications, monitoring vital signs, or coordinating physical therapy. Lastly, don't be afraid to ask for referrals to community resources that may be able to assist with your parents' care, including support groups, rehabilitation centers, or meal delivery services. Do you have any referrals to community resources for us? At NestCare, we're committed to ensuring your parent receives the highest level of care, whether they're recovering from surgery or managing a chronic condition. We work closely with families to provide personalized care solutions and connect you with resources that make caregiving easier. Navigating a hospitalization for a parent can be challenging, but you don't have to do it alone. By asking the right questions and engaging resources like NestCare's private duty nurses, you can feel confident that your parent is getting the care they need, both in the hospital and at home. Thank you for watching this episode of Parenting Your Parents. For more information about NestCare's services or to explore how we can help your family, visit our website or give us a call today. Don't forget to like, subscribe, and click the notification bell for more helpful content on caregiving.